The National Education, Health and Allied Workers Union has slammed Parliament for what it calls intrusive, personal, private and unnecessary medical tests on its employees. In a memo leaked to the Sunday Times, workers were allegedly told to disclose all prescribed and over-the-counter medication they consumed. Amongst other instructions, Nehawu Parliament Branch Chairperson Sthembiso Tembe joins us now for more on that. Bob Tembe, good to have you and thank you very much for your time. Parliament said that the union was consulted about these tests. He has also said that the tests were needed for staff, particularly those identified as high risk or exposed to potential hazards. Where does the confusion then arise?
Good evening, Pututabo, and to Newzroom Afrika listeners at home and viewers. Firstly, it's not true that the union was consulted. The consultation in terms of the recognition agreement means that the top management of Parliament must convene a meeting with the organized labor to discuss any issue that might lead to the change of conditions of service of the workers. There was no such meeting. They might have met with one or two shop stewards, but that is not consultation. So that one is not true. We need to categorically, disagree with the management in that regard. There was never any consultation whatsoever.
Was it explained, though, to Labour that some of the staff members, particularly in the catering, printing, protection services, artworks, restoration, audiovisual, broadcasting, ICT, transport, the interpreting unit and the National Assembly desk would need to have these particular tests for their own benefit? They're saying they're not meant to punish them, but they are for their benefit.
Well, we never had any such meeting. So as I said, they might have met with a shop steward or few, members of the union, but that does not amount to consultation. And even if they had met with those particular employees, in terms of the act that they rely on, Occupational and Health Safety Act, there must be committees that must be formed in the workplace, safety and health committees. And Parliament does not have such committees. And it is the responsibility of those committees to decide and determine whether certain areas should be categorized as such. So there was never any such meeting between the union and management. Now, it cannot be correct that every employee should be subjected to such intrusive exercise. They call it medical surveillance. In the event that there are certain categories of employees that we have referred to, for instance, those in the catering, those in printing, those in the languages, that particular surveillance must focus to those particular employees. It can't be correct that all employees must be subjected to that. If you read the infolette that they issued, they said it's compulsory for all employees of Parliament to participate in that particular process, and we don't agree with that.
Now, of course, there are instances where there are contractual agreements between employer and employee where such medical tests are part of the contractual arrangements. Are you saying across the board in terms of your members at this particular time, there are none of them contractually who are required to have such tests?
There could be some of those, as I mentioned, those in the languages, those who are interpreters, because sometimes they put these headphones for quite some time in their ears, which might lead to certain challenges. There could be those in printing that are using glue and other, substances that might be damaging as well. But even before that can be done, there must be proper consultation in terms of the recognition agreement. The language that was used also there in that info alert, they said it's compulsory. Secondly, they say you have to subject yourself to that process. You have to be there 10 minutes before the medical surveillance can be done. If you are late, they said then they are not going to consider you. Secondly, they say they'll regard that as non-compliance. That is a military conscription language, which is not acceptable in Parliament. But there was never any consultation. You are saying management of Parliament must do the right thing in terms of the recognition agreement that they have with Nehawu. They need to consult the organized labor so that we can discuss and ask questions, because it cannot be correct that will be checking in my intestine what is contained there and my stomach and everything. It cannot be correct. And even in those instances where it is warranted, I don't think it should be that much of a, intrusiveness that they're trying to apply. So we don't agree with it as it stands. But when we are consulted, perhaps they can be able to share with us those particular areas that we identified. Then we can have a discussion. But we don't think that it should be compulsory as well. You should be able to encourage workers to participate in the process. Because what happens if, in certain instances, it is found that, for instance, interpreters, their ears are not functioning properly. They never tested those workers when they came into Parliament. It means, in other ways, Parliament is admitting that whatever work that Parliament employees are doing might be damaging to their health. Are they going to pay for them? Now, in terms of that infoliate, they're saying those workers must go and consult their own medical practitioner. Who's going to pay for that? If Parliament is confessing, because Parliament is confessing that the kind of work and the exposure that some of these workers might be subjected to might be damaging to their health. It means Parliament must take responsibility.
But in a similar vein, I mean, what happens if those particular individuals are not tested, for example, that one is asthmatic and they're working with glue and it could affect them and prove to be hazardous at a later stage, but the employer has no way of knowing that without having done the proper tests. So what happens then thereafter? Does Labour then come and say, well, the employer must then therefore pay because now they've exposed this individual to danger when the employer did not know in the first place that there could be such a condition that existed with such an employee?
All what we are saying Parliament must consult the organized labor in terms of the recognition agreement. It can't be correct that they will be meeting with individual employees when the organized labor is there, then decide. And also in issue info alert, which says this thing is compulsory to all employees. I read the act. I did not see anything that speaks about compulsoriness of that particular process. It speaks about a number of issues, number of processes that must be followed before such decision is taken. And Parliament has done none of that. And I said Parliament does not even have the Safety and Health Committee as it should have in terms of the law. So what is guiding then this particular process that they want to undertake? We don't know. So, but they must meet with us so that we can discuss and say, first things first, let's have those committees wherein the organized labor is going to participate, wherein all the units of Parliament or sections and divisions will be represented, wherein the management will be represented in that particular committee, which will then discuss and determine if certain areas should be subjected to that process. That has not happened, and we think that Parliament management is undermining us.
So if I understand you correctly, you're saying as far as the Occupational Health and Safety Act, although it may stipulate, particularly regarding the health risks posed by hazardous substances and working conditions, one, it should not be a blanket approach, but two, it's not something that is compulsory. It's not like a conscription in the military that you must all undergo this, but it is something that needs to be discussed and consulted upon. And should that consultation happen, as Labour, you don't see a reason why those who require such medical tests to do so.
Exactly. So those who require that medical test, we don't have any problem if they say they want to do it and they also confirm that they're exposed. We'll support those. We don't have any problem, but we don't agree with the compulsoriness of the process, even without consultation. We need to be consulted properly. But already the Parliament management has indicated that they might meet with us tomorrow so that we can discuss this matter and try to find each other. But at the moment, we don't encourage our members to participate in that process. We don't agree with the process as it stands. It is being forced upon workers, and workers have got rights. It cannot be correct. For instance, I'm a researcher. What do I have to do with all those things that they want to do in my intestine and other things? So I don't agree with that. So it can't be just a blanket approach. They should categorize and identify those areas, not alone with the presence of the organized labor, with the presence of the management, with the presence of representatives from various sections of Parliament. Then we'll be able to move forward. At this stage, we can't be able to move forward.
Yeah. Do you encourage your members, though, to disclose? I mean, I'm sure in your own personal capacity, Tembe, you do go and have your checks and you would know if there are areas of concern and so forth and so forth. Is it encouraged then, therefore, to disclose those?
We don't encourage them because with our experience in Parliament, at times they don't protect the information. For instance, you'll remember, Putabo, that a couple of weeks ago, or a year, there was something that came out regarding the salaries of employees of Parliament. That was not protected, and certain people in the management were able to disclose that information. So we don't have confidence that even when the workers disclose, that information will be protected. We need to discuss all those things so that we know that workers are not exposed, unnecessarily, because we don't trust the manner in which information will be protected. And they also say they want, if we are taking prescription or whether over the counter, you have to come with that medicine. What do they want to do with that medicine? Are they going to give you another medicine or so? I don't know what they want to compare. So we don't agree with it as it stands. And we don't encourage our members to disclose their health issues before we can get that guarantee that whatever they disclose will be protected and will be safe.
Tembe, we appreciate your time. Thanks so much for coming on. Sthembiso Tembe, Nehawu Parliamentary Branch Chairperson, there on staff undergoing those health tests. Seems they are going to be meeting with management tomorrow to discuss that further. All right, let's take a break. In Focus continues shortly. Stay with us.